Today I'm sharing my best tips to relieve hip pain when sleeping during pregnancy. If you are pregnant and new to my channel, make sure you subscribe and click the bell button below so you don't miss any of my pelvic floor tips for an empowering birth and postpartum recovery. A lot of my clients report pain right on the hip bone when they are sleeping during pregnancy. And I would say it's especially true when they hit that third trimester when baby is getting heavier. So here are my best tips to deal with this issue. Strategy number 1 is use props for optimal body position. I highly recommend having a body pillow or a maternity pillow that you can put between your legs to keep them parallel. And this helps not only with hip pain, but also with pubic symphysis and SI joint pain and what have you. And it's just a great overall strategy to stay pain-free at night during pregnancy. Now place a prop just above your hip bone to fill that space over your hip where that curve is. And the idea is that the weight of your body will just be spread out over a larger surface of contact instead of landing on that one point of contact on your hip bone. I love using my Gorgeous ball for this because I can inflate it and deflate it the way I want and it stays in place through the night. But if you have a piece of fabric or a towel or anything else that you can fill that gap with, it's just that you're gonna need to fiddle around a little bit to find the right thickness and what's most comfortable for you. And the third prop that I suggest is something under your belly bump to just help offloading your hip. It can be a thin cushion or a folded towel or a small piece of foamy that you put under your belly. I tried using my body pillow to wedge it under my belly bump, but I find that it just doesn't stay very long in place and it slips away. If you look up pregnancy wedges online, you will also find more professional options which can very well work for you. And I know all these props seem like, oh my god, this is a lot of things to put around my body to make it work, but it is just the way it is, right? You are pregnant and you may need, 4 or 5 cushions around you to feel comfortable, and that is okay. Likely you're gonna flip around during the night and you'll have to, put those cushions back. But I think it is better than being uncomfortable all night. Tip number 2 is change positions, please, through the night. There are all kinds of myths out there as to which position you should sleep in during pregnancy. And truly, a lot of women end up not sleeping because they're uncomfortable trying to follow these recommendations, which, by the way, most of them don't have any evidence to back them up. So the only sleeping position really that you should avoid during pregnancy is on your tummy, and it's only as of your second trimester once your bump has popped. Sleeping on your back is okay for as long as you don't present symptoms like shortness of breath, nausea, or dizziness, which would suggest that your baby is pressing on those blood vessels and compromising circulation. Don't you worry, you can trust that your body will tell you if this position is not right for you, and you'll present symptoms and you'll wake up from them. If you do have these symptoms though, you can just prop yourself up a little bit if sleeping on your back is your preference. This way you're gonna be a little bit, elevated rather than being fully flat on your back, and this may actually fix the problem and then you're gonna be able to sleep. There is also some information circulating on the internet that it would be best to sleep on one side versus the other in pregnancy. Again, this is not evidence-based information, and it's totally okay for you to switch sides. It is natural for our body to move around during the night, otherwise it would be so uncomfortable. And I can totally understand why you would not be sleeping if you're constantly on your left side, for example. And then that hip pain will flare up right away, right? So yeah, if you have any concerns about sleeping in certain positions, I would recommend just checking with your healthcare professional, because the internet is not always the best source of information to make informed decisions. And tip number 3 is massage your hips before bed. You know what? A 5-minute self-massage routine at night can make a world of a difference on your hip pain. And all you need really is a tennis ball or a lacrosse ball for these techniques. So the first technique we're going to try here is against the wall. So you'll work at releasing the muscles of your glutes and also around the hip bone on both sides. So just finding those points of tension. You can also perform these massage techniques directly on your bed. And because your bed is a soft surface, it will absorb some of the weight of the ball, which can be a nice compromise if you need more pressure than from the wall, but you don't want to go directly onto the floor, which is even more pressure. And lastly, if you want more deep pressure, you can do these techniques lying down on a firm yoga mat on the floor. And again, same thing, you can either move with bigger movements, across the hip. You can stay on the pressure points 15 to 20 seconds when you find a point of tension, or do mini vibration. So I suggest doing these techniques before bed if you want to just start on the right foot, but you can definitely use these techniques as well during the night if you wake up in pain and you can't get back to sleep because of your hips. Sometimes it's worth getting up and doing a little bit of self-massage so you can get back to sleep rather than tossing and turning for hours. All right, I hope these tips will be helpful and that you'll sleep better from now on. Also, don't forget to grab my free prenatal book in the description below if you want to know more about my top tips to prepare your pelvic floor for a positive, empowering birth. Thanks for watching.